Welcome back, everyone, to our coronavirus coverage now. The state health department reported 9 new COVID-related deaths in Wisconsin. The total sits at nearly 4,900 now since the pandemic began. More than 1,100 people are in the hospital statewide with the coronavirus. And so this morning we are joined again by Dr. Jeff Pothof, UW Health Chief Quality Officer. And Dr. Pothof, as always, thanks so much for being with us this morning.
Good morning.
Okay, so let's talk about the post-holiday surge possibilities. What are you seeing and hearing right now as far as your concerns about that? Because after Thanksgiving, it seems as if the state did not have the post-Thanksgiving surge that health officials were worried about.
You're absolutely right. So after Thanksgiving, we didn't see that surge, and that was welcome. We still have our eyes closely glued to the data on post-Christmas and eventually post-New Year's. And for the most part, it's good news. We're not seeing a big surge. There are some indicators that might indicate we might see some increased cases. Percent positive cases are just a little bit up. That might indicate either more prevalence in the community or just decreased availability of testing. Another thing we watch is asymptomatic positivity rate, and that's just a little bit higher. Not high enough to say we're going to have a surge yet, but clearly keeping our eyes on some of these early metrics.
I have another question on the vaccine, doctor, in a moment, but just following up on that quickly, we do have a couple of weeks where we still need to wait to see that play out, right?
Right. So this week would be the first week that you would expect to start to see Christmas, and then it would be another couple weeks before you could conclusively say that New Year's didn't have an impact. So we're not at the end of the road yet, but so far haven't seen big spikes.
Let me ask you about the vaccine rollout in Wisconsin, doctor. You know, the CDC this morning, I was checking the latest numbers, says Wisconsin got nearly 210,000 doses of the vaccine distributed, but fewer than 70,000 doses of the vaccine have actually been administered. There's been such a push to get doctors, frontline healthcare workers vaccinated so you can do the important work you're doing in our hospitals. Where is this breaking down?
Yeah, I think it's breaking down in people developing processes for how to do mass vaccination, running into some bumps in the road, having to retool their process, and then hit the accelerator. I know that was kind of the story for UW Health. We started doing, a few hundred doses per day, now well north of 600 doses per day. And I imagine as people get comfortable, get used to this process, this will go much more quickly than what it did when it first started.
And so as we get more comfortable and it ramps up with the immunizations, what are you telling people who are curious about when they could possibly be able to get the vaccine? The average person who is not a frontline healthcare worker or in a long-term healthcare facility.
Yeah, I think, the average person, it's probably going to be at least March and then into April before we're starting to see, more widespread ability to get vaccine for the general population. Once we get into May, June, it should be a situation where if you want a vaccine, you can go get it wherever you're at. That would be our hope, that we can move through this that quickly.
Dr. Jeff Pothof is with UW Health. Doctor, great to speak with you again. Happy New Year, and look forward to talking to you again.
Great. Have a good morning, guys.
COVID testing sites in our area are returning to their normal schedules as well following the holidays. You can head to TMJ4.com/coronavirus now for a list of testing site hours